So this demo is for doing the Loloco thread to make the nose more beautiful. Okay, if we ask this model, she doesn't want the nose to be too high or too different, but she wants a natural lifted look to the nose, yeah, and she also wants the tip to be more sharper looking. So we are going to do a fully resorbable thread called Loloco. Loloco in Korean means apparently happy. Okay, so it makes the patient happy, so that's what we are going to do for her. This one is done under local anesthesia, so you can see the patient is just has some anesthetic cream, and then we close with Tegaderm just to make it more numb for her. Okay, then just one local shot which will feel like a tiny and bites, and after that the thread just goes in and it's very easy, and you will see. Okay, this thread is made of PDO or polydexaonon, which 100% by 8 to 10 months will disappear from the skin, but of course the skin has already formed collagen, which will give the lasting nice lifting of the nose.
There you go, Doctor. We had a sort of a teaser. And of course, hello, welcome back. We are speaking to Dr. Alice Prathama-Michael, cosmetic surgeon, total wellness consultant. As you saw in the teaser earlier, she was explaining this process for Luluco. Hello and welcome, Doctor. How are you doing today?
Hi, Lynn.
You're looking amazing as usual.
Thank you.
Now, we had sort of like a sneak peek of what that's all about.
Yeah, that was me actually.
Yes,
Did you recognize me?
Of course. It still looked fantastic, even though, under the, surgical gear and stuff. Now, of course, what do you have for us today? We sort of got a brief introduction of what that is. And I think during the short break, I wanted to find out a little bit more. What is Luluco? And who would be the people that would choose to take on this procedure?
Luluco is a natural but bioabsorbable, in a way we call it a thread, but I call it a soft implant.
Okay.
Basically, in the last 20 years or so that I have practiced cosmetic medicine, my theme has always been beauty from within. And I want to do things that will make people more natural, very nice looking, but at the same time does not have any long-term side effects, and I do not like things that stays forever on the skin, because we know things that stay a long time, as we know with previous procedures like with silicone implants and all that, do have certain side effects which I do not like, because I practice general wellness as well as beauty as a way of showing out your well-being to the world. So Luluco is 100% bioabsorbable thread. It's made of polydexaonon, and actually this product has been used with a lot of safety in cardiac surgeries, for general surgeries and so on for many decades. So there's a lot of safety in using this product. And number two, it gives a very natural result, as in it forms your own body's collagen. Not really acting just as a support as in the silicone or even fillers that we did before, but this is helping. There's many things that we call them biostimulators. Okay, for example, polydexaonon is one, we call it PDO, or the other thing is poly-L-lactic acid is another one. Then there is polypropanolactone, capronolactone. There's so many things, but polydexaonon is something that goes off a lot faster than other products from the skin. But when it is introduced into any particular area, it has the property to improve a lot of the collagen contraction around the area, thereby giving a better shape to areas. Or we also use it for facial or neck or even body lifting procedures, whereby with the lift, with the vector, if we say we put in like 4 threads this way, then the collagen forms around it and gives a traction lift. And it's not surgical. It's very minimally invasive. So it can be done under local anesthetic, as what I said.
Like what we saw earlier. You look like you have just done the nose area. And what were you going to do next? Lifting it by the thread?
For that particular model and for many of my patients, of course, in Asia we have a small gentle face. So we do not really need a Caucasian nose that stands up that way. But of course, by elevating a little bit of the the shaft or the base of the nose that's in between the 2 eyes, as you see in the model, it actually opens up our eyes. Asian eyes can be more open, and it and it brings attention to the center of our face. In a lot of clinical studies and in a lot of recorded, appreciation of a person's beauty, the eye goes towards the center. It goes to the two eyes. So opening the eyes bigger does give a more attractive look.
Right.
And then it goes to the center of the nose, which would be, your nasal shaft and your nasal tip. And then it goes on to your lips, and then it goes on to your chin. And only then it goes on to your cheeks or your upper forehead. So the eye traces that line of beauty. So I always focus when we are doing anti-aging or we are making someone naturally look better to focus on these particular features.
What I want to know is, we saw so hints of what's going to happen. Is it painful? Do you have how long does the procedure take, and how long do you take to recover? Is there recovery time required?
Okay, we have worked on people for so many years, so we kind of know how to make the person most comfortable. So for a lot of my procedures, they can be said that it is almost painless, basically because we are already giving the person, a pill to take, which is like a painkiller.
Right.
And then we are applying amla or local anesthetic, and to accentuate the process of the local anesthetic or to make the area numb, we're actually using a tagadam, which is like a plastic band that goes on top to cover and let the penetration of the amla go into the deeper layers of the skin.
Okay.
And after about 30 minutes of this, then I would do another shot of local anesthetic, which barely does not hurt. And I normally tell my patients, after that first shot, your nose feels like it is made of wood or stone.
It doesn't exist on your face anymore.
Just for that 1 hour, it always comes back, but during the procedure they feel almost nothing.
Okay.
And of course, when we are talking about the Luluco thread, it's got a very blunt cannula as a way of introduction.
What does it mean?
A cannula is a soft, pliable, it could be metal or it's plastic, but in this case it's metal, which actually allows the thread to be introduced. Of course, we take out the metal and the thread stays inside, but because the end of the cannula is very, very blunt, it doesn't cause any injuries.
Okay.
And it doesn't go to areas you do not want it to go, unless you really want to do it. Of course, we are using threads like this to even reduce nasal congestion for those of them with enlarged, nasal cavity, sometimes due to allergic rhinitis or chronic irritation in the nose. There are people who snore a lot, or there are people who have problems with one side being deflected and so on. So we can do gentle corrections, in which case we will go deeper into the cavity, but otherwise just for a cosmetic enhancement of the nose, it can be done on the shaft, the base of the nose, the shaft, which is the middle part, and also at the tip. So just by varying, the method of doing, we can elevate the tip, like what I did for the model just now, because she had a very low lying nose, so we actually can elevate it, and also we can, if the nose is a bit skewed to one side, we can also make it straighter. There are people you might have seen, your friends who have got humps and irregularities, in the top of the nose. That also can be corrected, and the nose can be made to look more straight and better. But most importantly, we accentuate the middle part or the center part of the nose face by doing the nose in a very gentle way.
Sounds good.
Just improving the, a slight projection. Many of my patients do not want major changes. Actually,
you still want to look like yourself.
They want to look like themselves, which is what I also like.
But better self.
but better still. But I choose Luluco now. I'm doing a lot, I've done hundreds to hundreds of them so far. I've lost count. I do that a lot because it's just for me, it's about half hours work, but for the patient is a lot of satisfaction, and they can go back to work almost immediately. It can be done like a lunchtime procedure.
Wow.
Because basically
there's no effects that you
there
will
be slight swelling that is from the local anesthetic, but because of the gentleness of the cannula and the non-irritating nature of the thread itself, and we are putting anywhere, for me, I would put anywhere between 10 to 12 threads, and basically we can get, the augmentation that they need. And they can go off within 1 hour, the swelling disappears according to my patients. But very less chances of bruising or getting any kind of major swelling or infections or irritations.
Yeah. I think that's a major concern with
Yeah.
a lot of people who think of wanting to get a procedure like this. You know, you've seen a lot of pictures on the internet
Yeah.
of people that have come out of surgeries, whatever
Yeah.
kind of,
Yeah.
it causes some kind of trauma,
Yeah.
and it takes quite some time
Yeah,
before
like a
you are able to
traditional
see the world.
rhinoplasties, you know, though the results can be quite nice, but it's a very, very fussy procedure. Sometimes cartilages are taken from the, you know, the back of the ear or from even the rib and so on to do an open procedure. Surgical procedure, the whole thing is opened and either an implant, silicone implant is placed or, you know, cartilages are used to constitute a more natural look. But it's such a major procedure, and what you said, Elaine, you know, it's about 1 month recovery.
Yeah.
You know, basically because the nose skin is very thin, and any kind of hematoma or bruise or swelling you may get may take 1 month to go. What you're seeing now is a patient who had her face lifted using the same thread, and this is halfway. You can see one side of her face has been lifted and the other side is down. This patient's major concern was all the lines that you see on the bottom, because she has very less volume. We've already given her some volume, but she still wants to be more lifted. So you can see the lines where she's, because of her sagging, you can see the lines in her mid face, which we have corrected by improving using the same thread. So there's many applications for improving the brow, for improving the neck contour, for improving the jawline, you know, and so on.
It's not just for the nose, it has various
Yeah,
applications.
but the threads are very special for different applications. It's not the same thread. You know, if you're trying to try, please do not. And anyway, these things will not be sold unless it's a qualified doctor and trained in the procedure. I act as a trainer for threads, all sorts of threads. And I train in Europe and in US, and I train doctors on how to use thread for different applications. So we do things like reducing the ala base, whereby the person has a very open nose, you know, with a big cavernous opening. We try to narrow it down, all by using threads. We give a nice, you know, bar-shaped lip shape, and all the threads that I use are always, you know, completely resorbable and safe. That is the most important thing. Brands matter, because if you do not know brands, you may be sold by things that is not very good. So
what
you
is
may
a name,
need to know.
What is a brand name that anybody is considering this should look out for in order for them to, you know, find that confidence to use it?
Yeah, I mean, of course, Luluco is one we are talking about today. But if you can look for polydexonone, but those that has got, like Luluco has got good clogs, we call it, which actually can hold on to the tissue and grasp to the tissue. There's other PDOs which I would not touch with a pole, basically because there is nothing to hold on to. They are short threads, and 100 to 200 is put into the face to no results, and no just a lot of swelling, and once it goes away, the face is again, you know, just very flabby. So like what we saw in the patient just now with one side lifted, I just used 4 threads, that's it. But the threads are of great quality, and they are PDO. But I also use polylactic acids and polypregnolalactone threads as well.
Sounds fantastic. That's all the time that we have. Thank you, Dr. Alice, for sharing. If you're looking for, you know, that slight lift, but it doesn't cost you a whole lot of time in terms of either the procedure itself or recovery, look for Dr. Alice Bernama. She is the solution that you should be looking for. We will be back later with more information and more news. Stay tuned, and we will be right back.